The latest research findings were presented before an audience that included Minister of Home Affairs and Information, Wilfred Abrams. He believes national toxicology testing resources, protocols, and reporting requirements are among strategies needed to address substance abuse.
While I fully support the adoption of a public health perspective, it is important to emphasize that this does not mean disregarding the legal landscape. Legislative reform in the area of drugs and the drug trade is essential, particularly in addressing synthetic substances and other new psychoactive substances. Our current laws often fail to adequately cover these emerging substances, leaving significant legal loopholes that must be addressed. Many jurisdictions around the world have already begun to make these critical legislative adjustments, including some of our Caribbean neighbors, such as Trinidad and Tobago. Their experiences and the measures that they have implemented offer valuable lessons that we can learn from and adapt to suit our own context.
According to Research and Information Officer at NCSA, Laura Foster, in 2023, the NCSA conducted interventions with people ages 4 through 65. But she says the drug landscape remains similar to that of previous years.
What we found was that about a third of those students, so 33%, who were tested on admission, they were positive for marijuana use, okay? And most of those who tested positive were males, and they were between the ages of 13 and 15 years. And that's normally about what we tend to see, right? That demographic. And what's still good news is no one tested positive for cocaine use. And we don't really see that, only once. I think we saw that over the years, but it's not a typical finding.
Ms. Foster adds alcohol, marijuana, and cocaine were the most prevalent substances on record. However, she notes there was an increase in female drug offenders, with ecstasy and methamphetamine noted as emerging drugs. And she has made several recommendations to step up the fight against drugs.
This, again, highlights what I'm talking about, that smoke, these small bits and pieces of emerging drugs that we cannot deny. We're seeing it in all the different pockets now, from treatment to the police, and now even in the forensic lab. So it's definite that we have something that we need to pay attention to.
Minister Abrams has acknowledged the recommendations and urges the NCSA to disseminate the report to the public. Rachelle Agard, CBC News.